Hi, I'm Peter Ellis and thank you for joining me. This video is all about what happens when you come for a therapy session. Our first meeting, of course, is to discuss your problem. You need to see a doctor first to make sure there's nothing in there, there's no nasty little thing that might need to be cut out causing pain. Other than that, if you refer to my other videos, what is soft tissue therapy and the type of people that therapy can't help. We'll go through all these sort of things, what sort of work you do, sports you play, and so you can work out exactly what might be causing the problem. I may be able to give you some hints on how you can reduce the pain, and then you can decide whether you want to go ahead with the therapy or not. So that's basically the first visit. Tension, anxiety and stress do not help in the rehabilitation of chronic pain. Therefore, it's important that your experience with soft tissue therapy is as relaxing as possible. Each time we may want to vent any problems you have, and this may be problems relating to people that are close to you. Therefore, I hold any information, anything you say or do during a therapy session in the highest of confidentiality. Because there is a fine line that I'm not allowed to cross, I'll choose a line down here. So any questions that people ask me, if it's not relating to their own therapy or their own problems, I will not answer the question. During the therapy, there's a high degree of communication between myself and my client. We have to communicate all the time on how the client is feeling. It's very important that there's nobody else in the therapy room to distract from that. So it's a purely one-on-one basis. Nobody else, whether it's a relative or a friend, are allowed in the treatment rooms during the therapy session. One of the things you learn when you're taking a course on soft tissue therapy is to treat the human body tissues as a chain. I just happen to have a chain right here with me. If one of the links of a chain is out up here, it pushes the whole alignment of the chain out. So what this means is that where you're feeling the pain may not be where the problem is. There may be a problem somewhere which is pushing your body tissues out of alignment, creating a pain somewhere else. So therefore we have to go through your whole body tissues one link at a time to make sure we're relieving all the tension that may be causing a problem somewhere else. Surprisingly enough, chronic pain can sometimes be caused by your body's own defense mechanism. For example, if I kept hitting my arm like that, my body wants to protect my nerves and blood vessels from injury, so it will harden all the tissues around that area. One of the methods we use within soft tissue therapy is to soften that tissue up. So we've got to send messages to our brain saying that everything is fine down here, you can release the tension, everything is okay. That means that our therapy has to be very, very gentle. We have to very gently soften the tissues, and more importantly, you need to remove the problem that's causing the tissues to be hardened. Most of the cases it's due to sports or work that you've done in the past, but if you're doing something at the moment which we think might be causing your tissues to harden up, you need to remove that to make the therapy more successful. A therapy session starts with muscle manipulation. This is basically just moving the part of your body that's going to receive the therapy. This is to get the neurons or signals going backwards and forwards between your muscle and your brain to let your brain know, hey, this is the part of the body that we're working on. Without those signals going, the rest of the therapy may be a lot slower or not be as effective. The next step in our therapy is to check your body tissues to make sure there's no hardened tissues, as I demonstrated earlier, that they've been hardened up for any number of reasons. So we just slowly go through and just feel all the tissues around the area they're going to work to make sure there's no tough tissues or hardened tissues in there, which would cause us a problem when we start the massage. If I hit one of those areas during the massage, it could possibly send you through the roof, so we need to soften that area first. Finally, the end of the session will be a massage. It's not a massage like you will find in a day spa centre. We work on a very small specific part of your body. We'll work a lot deeper in between your muscle fibres to free them up from the fascial tissue, which we soften up so that your nerves are moving nice and smoothly. We use a special cream which has got herbs in it, which softens your skin and also warms your tissues up so that it makes it softer so we can get in gently without creating any pain. So as I said, the therapy is gentle, relaxing and enjoyable. So I look forward to seeing you. Bye for now.